In this video, I'll be showing you a post-op massage for a client that has had Avéli. And I'll be using tools. I don't always use tools, but when I do, this is how I do it. So here I'm just draping the client. And I've already done manual lymphatic drainage, so I had turned her over, stimulated the whole big six, shout out to Dr. Perry. Here you're going to see two big circles, that's for scar tissue, and the smaller one was for the incision point of Avéli. So now I'm just going to be introducing the client to what areas we will be working. Starting off with light massage, working the thigh and the booty area. Here I'm just stripping the soft tissue, and this is her third massage with me, so I want to see if there's been any other areas that may have developed some scar tissue, anything that I need to work on. We're going to work on it today, and you're going to see me position her leg there, and I positioned it like that just because I like to encourage the lymph movement to the inguinal area. It's not a lymphatic drainage, but it's just to encourage some flow. Next, I'll be working with warm stones, which will start to relax the tissue so I can penetrate the scar tissue painlessly. The warm stones will also improve the blood flow and increase circulation to promote healing and relieve any type of achiness that she has. The client here, she's 3.5 weeks post-op, so she's not 100% healed. So I never want to put a hot stone on somebody that has tissue that's not completely healed. So we use a warm one. And you're going to notice here when I use this stone, I'm going to be switching it back and forth to each hand, using the warmth from my hand to put on her skin so I don't hurt her or burn her in any type of way. We're just looking to warm the skin up to prepare the skin for the scar tissue work. Medicuppping is my favorite tool. It is extremely versatile. There's vibration to it, there's negative compression that will pull the tissue up and release it, bring more circulation to the area, and will also give the skin a stretch to help stimulate lymphatic flow as well. It's also going to stretch the fascia underneath. Hands down, my favorite tool. Now I'm going to start targeting the scar tissue to break it down. And I'm going to do this just by compressing it. Sometimes the scar tissue will crumble right underneath, or it'll just kind of melt away. I like to target the scar tissue at all different angles. And you're going to notice here, I'm hyper extending my thumb right there because I have nails and I don't want to stab my client in the butt. So I'm going to reinforce with the other hand and just be very careful about how I'm compressing in here. And you're going to notice I'm not digging. I'm not getting too aggressive. And that's because with my experience, it's always been easier to break tissue down while the client is completely relaxed. I am going to mention that whenever I work scar tissue, it is extremely important, whether it's an invasive surgery like Lipo 360 or a tummy tuck, or even a minimally invasive procedure like Avéli, to wear compression afterwards. And the reason for this is because if you wear the compression afterwards, it helps the system out so much to keep that scar tissue nice and soft so that the lymphatic system could go ahead, do what it does best, and help get rid of it. Alright, wood therapy. Not my favorite modality, but this little tool I love because I have small hands and it's easy for me to control and target smaller areas. And as you can see, I'm not using this tool too deeply because it's not necessary. And these wood tools can bruise clients if you don't use them properly. And the last thing I want to do is cause them more pain than they've already been through. Going back to Medicuppping, and here you can see I changed the size of the cup and the setting is very low. All I'm really looking for right here is just to get a slight skin stretch so that I can stimulate the lymphatic system. And that's really all I'm doing. Achedaway Scraper. Now typically this tool is used on muscle. You're going to see I'm going to test it on my hand right here. That's because there's warmth on this tool. There's vibration on this tool. And I do like to use it for scar tissue work as well. And not getting crazy deep or anything like that, just scraping it down a little bit. And it actually feels really nice to the client. And that's a wrap for this patient here. That's her third massage. By the time I see her the next time, I know for a fact that scar tissue is going to be gone. The reason I know it's going to be gone is because I broke it down nice and slow. She wasn't in pain, and afterwards she's going to put her compression on. And the compression afterwards for scar tissue is everything. I'm adding a warm towel here, and I'm going to help her get some of this oil off, because just to be nice, I don't want my client leaving with oil all over their compression garment, because it's not something they sometimes wash all the time. So we try to keep it as sanitary as possible. If you like this video, please don't forget to like and subscribe.